You know, honestly, I'm not even really sure I should be talking about this with you guys. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 297, and today I want to talk to you about conversion rates when it comes to hearing aid treatment. But before I get into this video, do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So what am I talking about when I say conversion rates inside of the world of audiology? Well, basically, this is a term that we use inside of the profession to indicate what percentage of our new patients who come into the clinic actually say yes to treatment. Now, you might be thinking right off the bat that, like, Cliff, are you going to be talking to us about like sales and sales tactics? And maybe a little bit, but really what I wanted to get across here is this. I used to be a really shitty audiologist, all right? Like really bad, okay? Pardon my French. I'm not really talking about from the treatment side of things. When it came down to actually treating a patient with hearing aids, I would typically get good treatment outcomes because I followed a very strict set of protocols called best practices. This is even when I was a really brand new audiologist back in 2016. The problem is that I had a really difficult time when a new patient came into the clinic to get that individual to say yes to treating their hearing loss. Now, when you think about it, industry-wide, conversion rates are at or below 50%, meaning that 50% or less of individuals who come into the clinic who have a hearing loss say yes to hearing aid treatment. And if you ask me, this is probably the biggest reason why adoption rates of hearing aids are so low, not just in the United States, but around the world. I mean, you look at some other countries that are out there, they only have 10% higher conversion than what we have in the United States. They're still below 50% conversion, or adoption, I should say, because even when those hearing aids are completely free, meaning like you come in, you have a hearing loss, the hearing care professional explains the hearing loss to you, explains what your treatment options are, and less than 50% of those people even say yes to treating their hearing loss, even when the hearing aids are completely free. So it's not just a problem here in the United States, but I think that this is the biggest reason why, like I said a second ago, that adoption rates are so low. You know, here in the United States, I don't know what we're at right now, probably close to 40%, meaning that 40% of individuals who need hearing aids actually use hearing aids. Now, to go back when I was a brand new audiologist, there was a month that I saw 34 new patients, all right? And I worked at essentially a otolaryngology clinic for this, and those individuals had been identified with a hearing loss. The ear, nose, and throat physician basically said, okay, you are a candidate for hearing aids. Go talk to Cliff so he can get you set up with treatment. So these individuals would come down. They already knew that they needed hearing aids because the physician literally told them that they needed hearing aids. And then they came in to see me. And by the time I was done with my hour-and-a-half consultation with them, 100% of those individuals said, no, thank you. I don't want to treat my hearing loss, or I need to think about it. That is how bad I was at articulating the value of hearing treatment to my patients. Now, I've come a long way, and why am I even bringing this up today? Well, we just had our annual team meeting inside of my clinic, Applied Hearing Solutions here in Phoenix, and we look at a bunch of different metrics over the course of the year. And one of the metrics that we look at to determine how effective a hearing care professional is their conversion rate, okay? There's a lot of things that go into making sure that a provider has a good conversion rate. A, they have to be really good at evaluating a patient's hearing. B, they have to be really good at identifying what the actual difficulties are from a hearing perspective and a communication perspective for the patient. And C, they need to make sure that they help the patient understand that based on the test results that we have and what we know we can do with hearing aids, if we can actually solve the communication difficulties that the patient has. If we do a good job on all three of those things, what ultimately happens is a higher percentage of individuals who need hearing treatment say yes to hearing treatment. I mean, like I said, I was at one point in time, a 0% provider, meaning that it didn't matter who you sent to me, how bad their hearing loss was, how much they needed hearing aids, whether affordability was an issue or not for them. 100% of people would say, nope, I do not want to get hearing aids from you, Cliff Olson. Well, I'm happy to say that at our annual review yesterday, we actually have 3 audiologists, doctors of audiology inside of my clinic, me being one of them, Dr. Leslie Balderas being the second one, and Dr. Kelsey Beck being the third one. And the reason I say number 2 and 3 is because that is the order in which they started with the clinic. In fact, Dr. Balderas was my first extern student who basically finished up her clinical rotations with me before she graduated, and then she has stayed on with us over the past several years. Same thing with Dr. Kelsey Beck. But honestly, one of the things I'm most proud of is that these individuals, these audiologists, they are substantially better than I ever was, right? And what I mean by that is that they have the ability to, when a patient comes in needing hearing help, they have the ability to articulate the value of the treatment and encourage that patient to say yes to hearing treatment. We are anywhere between 76% and 90% treatment conversion rates inside of the clinic. You know, I'm happy to say, and I'm actually proud of myself for this, I spent a lot of time figuring out how to effectively communicate with my patients to help them understand the value of treatment and be able to articulate what I could actually do when it came to hearing treatment to make them feel confident that I was able to treat them effectively. I have been at around 90% treatment conversion rate for the past several years at this point, meaning that 9 out of 10 individuals who come in to see me ultimately say yes to hearing treatment. Of course, there is always that 1 out of 10 individuals who say, nope, you know, sounds great, Cliff, but I don't want to do treatment with you. I either want to go somewhere else or I don't want to treat my hearing loss at all. And that's honestly the thing that keeps me up at night, because I know that once someone says yes to treatment, that I can effectively treat them and get them hearing their absolute best, because we follow a very strict set of treatment protocols. With that said, to have my other providers be at a level between 76% and I believe 82% or so, that's fantastic when you consider that the industry average is below 50%. And here's the thing, we don't have to do any special sales tactics. I saw someone posting on social media the other day, someone who said that they worked at Miracle Ear back in the day. They ultimately left Miracle Ear because they didn't like all the high pressure sales and the tricks and the scare tactics to get their patients to say yes to hearing treatment. So they essentially left the profession. And I think 5 years later or so, they said that they're like, you know what, they want to come back and they want to start their own clinic, but they were looking for advice on how to do consultations with their patients that came into their clinic, because they did not want to fall back on their old ways of using these sales tactics and scare tactics on their patients to essentially scare them or trick them into saying yes to hearing treatment. When, like I said, when you take a really deliberate focus on listening to the patient, listening to what their wants and needs are from a communication standpoint, doing a really thorough hearing evaluation to where we can fully understand what's going on with their auditory system, communicating what is actually going on with their auditory system with the patient so they truly understand why they're having those difficulties, and then ultimately making a recommendation and helping them understand how we can solve those difficulties with the recommendation. When you do that, you never have to sell anything. Right? You never have to come out with a bag of tricks to try to fool people into saying yes to hearing treatment. You basically just create a bunch of education. You make sure that it's very clearly explained. You make sure that you're very articulate when you explain these things to a patient. And then they come to the natural conclusion themselves that the most logical thing that they need to do to solve this problem that they came in for seeking help for, that they can solve for, right? Honestly, like I said a minute ago, this is probably the thing I'm most proud about, because I could have been the most exceptional audiologist from a treatment perspective, and my other associate audiologists, they could be exceptionally good at treating hearing loss. But if you can't have that person on the other end who's coming in seeking help saying yes to what you're offering them, the thing is that once they leave your office, they're gone for another 5 to 7 years before they seek help again, which is really scary. And potentially even more scary than that is that they choose to leave you and they go somewhere else thinking that they're going to get the same type of quality of care, and they end up getting really low quality of care, but it just costs them less to go to that other place. It's ultimately us letting the patient down if they say no to what we're offering them. But I'm happy to say that our treatment conversion rates are among the best in the entire industry when you look at statistical data across the entire profession, which means that if you have either yourself or a significant other who is struggling to hear, and you want to make sure that they say yes to treatment, and you want to make sure that you say yes to treatment, coming into Applied Hearing Solutions is a really good idea. However, if you're someone who does ultimately not want to treat their hearing loss, the worst thing that you could do would be to come into our clinic, because chances are, once we educate you, you're going to get to the point where you're like, golly, I really didn't want to treat my hearing loss, but I don't see how I could say no to this. So again, if that's you or a significant other who ultimately does not want to treat their hearing loss, and you just want to appease someone else by saying, yeah, I'll go in and get evaluated and I'll see what they have to say, then don't come into our clinic, because chances are when you come into our clinic and you hear what we have to educate you about, you're probably going to say yes to treatment. We specifically try to attract individuals who want their hearing loss treated at the highest level humanly possible. We don't try to attract the type of individuals where we're giving discounts to treatment, or doing shortcuts, things like that. You're going to have a high level of financial commitment. You're going to have a high level of time commitment if you come in to see us at our clinic. And in spite of those things, having such a high treatment acceptance rate, I'm really proud about. One thing that I wish that our profession would do a better job at is educating younger audiologists how to consult with patients to solve this problem of low treatment adoption rates. I mean, if we were better audiologists and better hearing instrument specialists at communicating with our patients, which is ironic because we are in a communication profession, but if we were better at communicating the value of treatment to our patients, chances are we wouldn't have adoption rates as low as they are. And I know you're thinking, well, Cliff, the adoption rates have a lot to do with how expensive hearing treatment is. And I would say to you that no, it doesn't. You can have clinics that have below 50% conversion rate, that have treatment options that are in the hundreds of dollars, or that offer over-the-counter options, and they still can't get their patients to say yes to hearing treatment, because it has everything to do with a patient understanding the magnitude of what it means to treat their hearing loss, and ultimately the magnitude of what it means if they choose not to treat their hearing loss. It has very little to do with money. On top of that, there are a lot of organizations out there that can get you free hearing aids, right? There's charitable organizations, and you just have to do the research and find them in your area. So low treatment acceptance, it's either because we are really bad at doing what we do from a communication standpoint and encouraging patients to say yes to hearing treatment, or it's a lack of knowledge and understanding out there in the world of consumers, and I'm trying to help correct that with this channel. But I want to know what you think. Would you rather go to a clinic that has a low treatment acceptance rate or a clinic that has a high treatment acceptance rate? Let me know down in the comment section, and I'll see you next week.